All right. So, everyone, thank you for joining me today for our clinical education information session. We are so excited to have our students work with you during this 4-week rotation in the outpatient setting. So, for those of you that are very familiar with our program at Spalding, so we are a hybrid program located in the center of downtown in Louisville. Here's our building. We have a fairly new program, so we're in our 3rd year of our program right now, and are currently have 3 cohorts and are currently in the process of full accreditation. So we'll be having a self-study due this summer, and then a site visit in the fall, and hopefully full accreditation in early 2027. So here's a picture for those of you who haven't had a chance to visit yet. We'd love to have you come and see our space. We're looking forward to being able to host activities and events in our beautiful facility, and we would love if you all have any input about courses or anything that we could do to support you. We would love to be able to talk about those things and support you. Here is pictures of our wet and dry anatomy labs in our building. So just to give you a little flavor and taste of what it's like for our students in the classroom. So our program structure, as I talked about it, we're a hybrid program and our academic year begins in August. Our program takes a little bit over 3.5 years to complete, with our students graduating in May. We have a hybrid model of education, which means our students perform learning asynchronously. So they do things on their own, such as lectures, they do activities and assignments. And then we also have synchronous sessions where students meet with the professor from each course for an hour or two each week. And then they come in and perform labs in person for a week. So why do we really use a hybrid approach? So it allows a lot of flexibility for our students, for those who want to work. So a lot of them have jobs on the side. They may work 3 days a week, and then spend 2 days where they're doing their content review, working on a lot of going over their specific content with us during our synchronous sessions. And then they also have the evenings and weekends to work on their content. This also allows for our time interacting with our students to be based on application and not just straight up lectures. So it just really improves the value and quality of the time that we spend together. And then it also allows for us to use a variety of different tools to enhance our students' learning, especially those throughout the digital and virtual spaces. So the mission of our clinical education program is for students to demonstrate a sufficient scope and breadth of activities in the professional practice experiences across the continuum of care and the lifespan that's representative of diagnoses that are commonly seen in physical therapy practice. So really what that means is we want to make sure that our students are seeing a variety of different diagnoses, patients and all the way from birth to the older, very aging geriatric adult, and with a variety of different diagnoses. So cardiopulmonary, neurological, orthopedic, neuromuscular, all of those things are things that we want to make sure our students see while they're in clinic. So the structure of our clinical education is that our students go out for their first full-time experience during their 2nd year of in the spring. So they've already had a full year and then 2 semesters of content. So they're well versed in their orthopedic content, their general patient care skills. They've gotten all of their basic sciences, foundational sciences like that anatomy, physiology, neuroscience, that pathology, cell systems and diseases. They just are completing their cardiopulmonary coursework right now too. So they really do have a good foundation in their ability to get in and get their hands dirty now at this point. The second clinical experience is 8 weeks, which will occur in the fall of the third year for our students. Um, the summer of the third year is when our students will complete their third clinical experience. Well, they'll have an 8 week rotation, and that's more in the neurological setting. And their last experience is 12 weeks, and that's in the spring or the last semester of their fourth year. And that's kind of a optional, a kind of rotation where students have a choice of where they want to be placed, but also we base their placement on where they need the most experience too. So we put those two things and prioritize those two things when we place them for their last clinical experience. Okay, so I want to show you next our Poster for Kids School of Physical Therapy site resource page. Um, so I'm going to stop my screen share and show you that page so you know how to use it. It has a bunch of resources that are helpful for you to use while you are working with your student. If you have any questions, this is a great place where you can find lots of resources, things about just our clinical education program, our structure, and then also things about using our um, evaluation tool, so the CIET, which we're going to talk about in a little bit. So I'm going to share the screen here. So I will give you guys a link in the email that I send up following up after this video presentation. But I want to introduce you to our site resource page. So on here, you can look and you can see various different things. Our clinical education schedule. So you'll see most upcoming this upcoming rotation. The dates are there, but you can also see the other rotations for our other cohorts and our other students. Um, I'll go back to the homepage. So program-wide resources for clinicians, it may be a little bit, is just more vague in general. So you can find things like our clinical educator handbook there, general resources, which we're going to talk about a little bit more about the CIET or the Clinical Internship Evaluation Tool, general forms, um, so things like our student goal writing worksheet. So things that this is basically an exercise for the CI and the student to perform when the student initially comes out into the clinic to kind of open things up and allow for a relationship, conversation, dialogue between the student and the clinical instructor, kind of talking about goals and things that students are, looking to maybe experience during their rotation, but also goals for the CI for the student to meet during their rotation with them. There's also a weekly planning form. So this is something that is helpful to go over each week with students, kind of like those highs, lows, things to work on. And also a way to set goals together. So kind of thinking about different activities that PTs do and you'll be assessing the students on. There's communication, evaluation skills, treatment skills, and then the affective domain. There's an area for strengths or areas of improvement, and then improvement needing and following areas. And then the goals for the next week. So this is something that you can go through with your students, and it allows you to kind of set some ideas of goals of what you want to accomplish, but also, give the student that positive feedback about, what they're doing really well and what's working, to help build on your relationship with them. Hopefully this never happens, but in the event of a student doing something that, we would consider a critical incident, we really want you to make sure that you're reporting that to me immediately. And then we're documenting it because I need to intervene. So critical incidents would be things that are serious breaches of professional behavior. So thinking about that unprofessional student violating HIPAA policies, not being ethical with the patient, or violating any patient safety is something that really is of major concern to us, those red flags. So those are things that may keep a student from successfully completing their clinical rotation. So first of all, the instructions carrier just said, I immediately want you to report that incident to me. And then we'll discuss that incident with the student. Then going through this process, we'll document the incident and what exactly occurred and write up a student critical incident learning contract. And in that, we're just trying to make sure we address the student and make sure that they're making those changes. Things like always being late to their rotation, that to me is a concern and needs to be um, address and we need to implement a learning plan. So I'm going to go back and show you a screen for the critical incident student learning contract. And so this is something I would help you all fill out too. But this is where you would talk about the performance issue, what exactly happens, and then a required standard or expected standard. And then we'll talk about together with the student collaboratively improvement actions and then review. So when we're going to review to make sure that student is making satisfactory progress. So this is a way to help hold that student accountable and make sure that they're making those changes that we require of them. Again, hopefully we don't have to use any of that, but I want you guys to know about that so you're able to know to communicate with me and then what the process is if we have to go through that. Additionally, some teaching resources that may be helpful for you. The Ohio-Kentucky Consortium has tips for CIs and SECEs, which can be very helpful. So feel free to go ahead and go to that website. You can look at that. They're also here. I have linked a video that is through the NCCE. It's a webinar that talks about facilitating clinical reasoning. There's also a free teaching and assessing clinical skills course that's provided on Coursera through the University of Michigan that you could go through on your own time. But I just want to give you all these resources. I know in PT school, we're not given a ton of information about how to teach. And sometimes, when you get, even that high level student that's doing really well, what do I do to give them an additional challenge? Or that student that may need a little bit of extra help, sometimes it's helpful to have these resources to go to give you a little bit more tools to help that student really excel. Another one on here is just I'm sorry, what's going on? So critical thinking versus clinical reasoning is a very important skill for our student physical therapists. So here's a video from ACAPT just about the difference between critical thinking and clinical reasoning and kind of be able to apply that. And then there's also a collaborative 2-in-1 student CI clinical education toolkit. So this won't be applicable to any of you during this rotation, but some of our CIs will have 2 students with 1 CI. So that's a resource for them. I'm going to go down into course-specific resources now. So we're under professional practice 1, and I'm going to do my best to see if I can have Exxat kind of make this a little bit more user-friendly for you all. But if you're going to try and find this specific course, what you want to make sure that you do is kind of hover over that professional practice 1 course, where you'll see the class of 2028, the 2025-2026 spring. That'll let you know that you're in the right area. So I'm going to go under clinical educator resources. So some of these are things that you've already seen that I just showed you on the other page, but things that are specific to this course are a handout that I sent you guys a little earlier on, just about our courses, what our students have gone through curriculum-wise, which is always a big question. So here you can find exactly what our students have gone over in the courses that they've taken so far. It talks about communication with me. Here's a very helpful table of your tasks as a CI. So it has the things that you must do and your responsibilities as a CI, as well as their due dates. So those are in that table. And then student responsibilities. You're not responsible to do these things, but just so you know what's going on with the student, these are their responsibilities. So they are going to probably come up and ask you towards the beginning of your internship details about yourself as a CI, if you have extra training in any different areas, a board certification, kind of what the clinic environment is like. The students are also asked to create and complete a patient diagnosis log. So we want to make sure that they're abiding HIPAA policies and are not violating in any way. But just writing the patient's age, their medical diagnosis, the PT diagnosis, and then if there's any interdisciplinary or intradisciplinary care that's involved, is just really helpful for us, making sure that our students are being able to see that wide variety of patients of a variety of different ages, and then of a variety of different diagnoses. Um, Also, there is a midterm and final CIET, which we'll talk about. That's our assessment for our students. They also do an assessment of their clinical instructor at the midterm and final, which we'll review with you. The student does an evaluation of the clinical instruction in the clinical site as well as the clinical instruction. So I'm going to go back. If you want to look at any of the benchmarks, we'll go over a little bit later. They're all in a document here. Sorry, the server's having issues, but we'll go over that in our session, so no worries. The DPT curriculum, here's a link to our website if you want to look at that. Our clinical educator handbook again. We've got a YouTube channel, so that has information, and it will have our session today that's recorded, so you can access that. You want to go through it another day, review anything, if you have any questions pop up. The other forms on here we already talked about, so I'm not going to review those again. And then CIET resources. So these are resources through the Exxat system. And they have not only help guides, but they also have some instructional videos. So these are going to be really helpful as you get ready to do that CIET and you are really evaluating the student for the first time during the midterm and then also the final. I'm going to just point out the operational definitions, which is really helpful for our students and our clinical instructors. I'm having issues with my links today through Exxat. I'm sorry about that. But I will make sure those are up and working for you. This PDF is basically tells you, I'm going to have to upload that for you all. But that PDF basically tells you different definitions that we're going to go over in this presentation. So I'm going to stop my share and go back to our PowerPoint presentation. Does anybody have any questions so far? No, I'm rolling through a lot of that stuff. All right. So hopefully, too, as you get a chance to look at it and get hands-on, you will be able to get into that a little bit more. And if you have any questions, always don't hesitate to reach out to me. I'm going to share my screen here. All right. So I want to introduce you to the Clinical Internship Evaluation Tool. So a lot of people are familiar with the CIET, but less are familiar with, with the CPI, but less are familiar with the CIET. So the CIET, we're using this because it's easier to use. There's less redundancy in items, and our CIs a lot of times tell us that they spend a lot less time doing the CIET than the CPI. And the scales are graded with better definitions. There's a little less redundancy and it's a little bit more straightforward. So when we look at time, just like I said earlier, there had been a study that showed that CIs and students both spend significantly less time on the CIET compared to the CPI. So that CIET is that blue bar, and the orange one is the orange bar is the CPI. So you'll notice really the CI spend, anywhere from 30 to 45 minutes on the CIET. And for the most part, and you're seeing kind of the average for the time spent on the CPI is around 60 to 75 minutes at the most. So significantly less time is spent, which is valuable, we know, to our clinical instructors. And then also the preference, which this is really big, is that kind of when comparing the student and the CI, that's in the blue. The CI is just in the orange, and then the student is in the gray. So this is a percentage of the students and CIs that really preferred using the CIET in that first column on the left. The CPI, That was around 20% that really preferred the CIET to the CPI, but we had about 70% that really preferred the CIET to the CPI. So that information really made us feel like we should use the CIET instead of the CPI. Now, there are pitfalls of the CIET. There's less research with it, and it's not quite as known and familiar to our clinical instructors. So, before you complete your first CIET and your first assessment for your student, you have to go through and do the CIET quiz on Exxat. So, you'll have to score a 75%. Now, this training session will hopefully help you learn a lot of those things. And then there's also a mandatory module for you to go over an information in a video on Exxat. So the CIET is split up into four sections. There's the standards for professional behavior. There's the standards for patient management, and then also the comments on areas of concern and strength and global rating of student clinical competence. So we start off with our standards for professional behavior. So you're probably familiar with these on the CPI of things like safety, professional ethics, communication, things like that. So these are 19 questions that are related to professional behavior for the CI to complete about the student. So safety behaviors really address whether the student is following health and safety precautions required at your facility. More of the professional ethics are addressing the student's knowledge and compliance with rules and regulations, ethical standards, and legal standards, as well as their professional appearance and conduct in the clinic and during interactions. Initiative is the student's ability to maximize all opportunities for learning during the clinical affiliation, to begin that problem solving and to seek out, guidance and really implement that constructive criticism that you give them. And then those communication skills. So that looks at students' ability to communicate not only with patients and their families, but with other healthcare professionals, but also their documentation. So how they're doing their home programs, and any other required paperwork like communication with other doctors or other medical professionals. All right. So when we're evaluating students on their professional behaviors, we use this grading scale. So never would mean that, oh, I'm sorry, never would mean that it never occurs. We're never seeing that behavior at all. Um, Rarely means that we're seeing a behavior occur less than 25% of the time. Sometimes, as you can see, is a 50% occurrence. Most of the time is greater than 75% occurrence, and always is a 95% of occurrence. Now, there is room for not observed. There is an option for not observed, but that's only in the communication section only. So, this is an area that we really focus on for our students, and we want them to show a great deal of professional behavior from the onset of their fieldwork experiences. So we want to make sure that they're showing safe professional behavior and demonstrate a good amount of initiative just from the start. So if this is something that a student is really struggling with, please, don't hesitate to reach out and let me know because I want to do everything to make sure that that student is performing as expected. Okay, so kind of breaking this down and kind of looking at those standards for professional behaviors. The first section is safety. So things that you're going to be asked about as a CI under that safety section are one, do they follow health and safety precautions? So things like anything that makes sure that they're following health and universal precautions, any standards that you have at your clinical site for safety, we want to make sure that they're following those. Also that they're taking appropriate measures to minimize risk of injury to themselves. So making sure that they're showing appropriate body mechanics, for example. Another thing is taking appropriate measures to minimize risk of injury to patients. So making sure that a student or that their patients are given proper levels of assist is an example of that. And then did the student meet the program's clinical performance expectations for safety? So that's just a yes or no. And our expectation for this rotation is that students meet that most of the time. So here's what it looks like on the CIET form in Exxat. So you have a little bit more familiarity. So you'll see that there's an area where the students will rate themselves and you'll also rate them. You guys can do this at the same time and complete this at the same time. The student is going to assign you as their CI, and at that time, when they assign you as their CIET or their CI for the CIET, it will send you over their evaluation. You'll be able to start their evaluation. Once you and the student have both finished the evaluation, you will be able to go over that together. So as you can see, these are these different areas where I just discussed about the safety standards that we're having you evaluate the students on. Okay, so here to look at that, there's that never, rarely, sometimes, and always selection mark. So as you can see, there's a place for the CI and the student to do that. And then there's an area for comments. So this is a professional ethics section, but for all the different sections, you're going to have a place where you can comment as well as a student. We encourage the student to comment, but we'd really like to see any areas of strength and areas and opportunities for growth for our students. So professional ethics. So our expectation for this is that our students always demonstrate professional ethics. So these are things on your CIT that you're going to see asking about the student demonstrating compliance with regulations for patient privacy, confidentiality, and security. Them demonstrating a positive regard for patients and peers during interactions. And demonstrating cultural competence and showing tolerance of and sensitivity to individual differences. And then also that they're adhering to ethical and legal standards for practice, including the Practice Act and the APT Code of Ethics. Um, Additionally, you'll see on there is questions about maintaining appropriate appearance and attire. There's also maintaining the appropriate professional conduct and demeanor as per the Code of Professional Conduct. So there is a link there, and you can look that up through the APTA if you need any refresher and review. There's also a section that asks you to ask if the student is demonstrating awareness of the patient's rights and responsibilities, and again, if they're meeting expectations for the professional ethics. So under initiative, this is something that we expect our students to demonstrate most of the time. The student should recognize and maximize opportunity for learning, implement your constructive criticism, um, utilize resources available for problem solving. So, you may see them, we tell them that they should have access to their materials and resources from their courses. So, if they are pulling out their laptop, that should be for looking up those resources. So please let me know if they're utilizing their, any electronic resources for um, any other things during their rotation, because it should just be for utilizing their resources from courses. Also that they're a positive contributor to efficient operation of your clinic and being a team player and also demonstrating flexibility. And again, we're asking at the end, did the student meet that clinical performance expectations for initiative? So for communication, this is a sometimes one. And that is really because our students are still figuring out communication as far as documentation goes, how to really communicate with those patients and families and caregivers. This is their first time they're really getting out and doing that. Working with other healthcare providers and communicating with them. And then also, completing documentation to other professionals if they need to do a note to a physician or a letter of medical necessity, things like home programs additionally. So at the end, there's also that question to see if the student is meeting performance expectations for communication skills. So our standards for patient management is really more of those hands-on skills, like examination, which includes the history, systems review, tests and measures, the analysis and synthesis of data, critical thinking, identification of impairments and functional limitations is evaluated by CIs and students under the evaluation section. And then diagnosis and prognosis means the PT diagnosis, the prognosis for the episode of care, the frequency and duration of care, criteria for discharge and appropriate treatment, and then intervention, which applies treatments, patient education, monitors patient response, and adapts accordingly, and then recognizes when outcomes, PT outcomes have been reached. So in this section, our students are really compared to a competent clinician who is able to skillfully manage patients in an effective and efficient manner, manner within and achieve an effective outcome. So we're looking at that they're either well below, at that level for familiar patients, at that level for all patients, or above. So I'm going to go over those definitions in the next slides here. So a familiar patient or presentation, which we're going to talk about, and you'll see in the definitions that we're talking a little bit more, is just a patient diagnosis or a problem that is seen frequently in your setting that the student has been exposed to in their didactic curriculum, something that's a pretty straightforward evaluation and treatment, maybe something they've seen more than once that they're seeing again for another time. But it's not a patient who has a really complex medical history or complicated course of care. A complex presentation is something that you may be seeing very rarely at your clinical site. Something that the student maybe did go over in their didactic curriculum or isn't as familiar with. And the patient generally has a complicated course of care for that episode of care that you're seeing them for, complex medical history. So the level of CI support, so that's divided into three kind of levels. So the first one is guidance. So this is more at the beginning. Those students are just coming out into the clinic right now. We're expecting them to need a little bit more guidance, especially initially. So they're really dependent on the CI to direct the evaluation and patient treatment. The CI is present throughout their interaction. And then they need to discuss with the CI after each step of their evaluation and treatment. So as the students progress, get more comfortable with your situation and setting, they should really be showing that they need more supervision when they're with you, especially towards that midterm and final, that they're carrying out an evaluation and treatment, just being monitored by their CI for minor errors in technique or facilitating decision making. And that the student makes correct clinical decisions with just, a few verbal cues or suggestions from the CI. And that the CI really is not directing their decision making, that they're just more helping to guide them and supervise them. And then independence. So, this is what we're looking for really with our students as they get into their last rotations, that they're really directing the evaluation and treatment independently and getting an effective outcome, that they're, consulting their CI when they're needing some clarification for clinical decisions or when they need a little bit of assistance or help for that plan of care evaluation. And then they're really just demonstrating the skills of a competent clinician. So well below is, that area where the student would need guidance from their clinical instructor to complete an item for all patients. So whether that be more of those complex patients or more of those familiar patients. What below would be a student that requires supervision or has difficulty with their time management while they're completing the item for all patients. They may need guidance for those that are complex presentations, but supervision for those familiar patients and presentations. At that level for familiar patients means that students can independently, at the level of a competent clinician, manage patients with familiar presentations, but requires supervision for those more complex patients or patients with complex presentations. At that level for all patients means that students can independently manage patients with familiar and complex presentations, that they really carry what is considered an appropriate caseload for that clinic, and achieve really effective outcomes with their patients. They also are at that level of a competent clinician in your setting. So, kind of thinking of more that entry level if you're thinking about the CPI. And then above. So this is something that goes above and beyond what you were to expect for a new grad, or a entry level clinician. So a competent, above a level of a competent clinician, their clinical skills are highly effective and they're demonstrating the most current evidence in practice. They carry a higher than expected caseload. They're really actively seeking out and developing independent learning opportunities, and they're serving as a mentor to other students, and providing resources to clinical staff. So for our students in this rotation, we're really expecting for their patient management that they're well below or below for any skill level. Our students hopefully are below or even approaching at that level for those familiar patients by the end of their rotation. So there's also an area that we talked about where students and CIs can write their overall comments. So thinking about things that are specific challenges, specific areas for improvement, strengths of each student are very important for both the student and the CI to be discussing here. This is where we tell students, provide evidence about why you graded yourself the way you graded yourself. And kind of CIs, this is where you can give a little bit more information about why you feel the students are demonstrating the level of performance where they are at that time. So our global rating of student clinical competence. So if you can see the scale, it has a 0 to 10. So 0 is well below a level of a competent clinician, and that 10 is well above the level for a competent clinician. So we have you do this during the midterm and the final. And what we're looking for is that the student really improves on that scale from being lower on that global rating to a higher level. So they're showing an improvement in their overall ability to demonstrate competency as a PT clinician. And then there's an area where it just generally asks, is a student performing at a level that is satisfactory for his or her current level of education? So this is like a big red flag for me. If you feel that the student is not performing at expected levels where they are in their program, or where you feel like they are in this rotation, let me know, because that just flags for me that I really need to intervene there. And then there's also a place for you guys to both provide your signature that you went over this together. So you and the student will complete the CIET at the midterm and the final. Also, the student will evaluate clinical instruction at the midterm and final and review that with you as a CI, and they'll have you sign that off. The student will also evaluate the clinical site just at the final. That's something that they'll go over with the CI as well. It's super important for me to have you all evaluate me as a DCE. So the student will evaluate me as the DCE and then also you as a clinical instructor. And I'll have you evaluate me as from a DCE standpoint, but also from our educational program standpoint to tell us about our student preparedness and give us feedback. As we're a new program, we really value your feedback and input about strengths of students and then areas that we could improve upon student education before they go out into their rotations. So just to review what direct supervision is, it is legally being physically present, immediately available for supervision. So making sure that you're not running out and running an errand when your student's seeing a patient. But the PT or PTA must have direct contact with the patient and client during each date of service. So making sure that, if a patient is seeing our student, that there is some touch point with your patient as a CI. So just general recommendations for success for our CIs. So my job really is to provide and help you be, the most effective clinical instructor that you can be. And so please don't hesitate at any time to reach out to me if I can in any way help provide you with any information, resources, or guidance towards being that best CI. So I always recommend starting with an introductory conversation with your student. We talked about this a little bit earlier with that weekly or with that introductory conversation, that goal sheet. So you can do that by setting goals, having your student talk about their goals, talk about your goals for your student, and then general opportunities that you and your student may have. Using a weekly planning form, we talked about that also earlier. That's something that can help you review objectives for the week and set expectations about where you'd like to see the student perform by the end of the week. And then again, if a student is not following any expectation that your expectations are meeting adequate progress, please reach out to me. And then providing feedback to students. So using things like the compliment sandwich. So, we want to make sure that our students are getting constructive criticism, but also trying not to be affecting their motivation levels. So, always making sure that as you provide those constructive criticisms, that you guys give them also some positive encouragement too. Making sure that you're very specific in what feedback you're giving them. So if you can talk about, a specific instance where a student demonstrated a certain skill that needed to be improved upon, talking about that, and then talking about how they can change that or improve it. Really, the evidence shows that immediately giving feedback is much more effective, which you probably have experienced as a PT, than waiting to give your feedback. So again, make sure you're doing that in a way that, may not be right in front of another patient. That's very respectful for that patient, but maybe having a debrief at lunchtime instead of just doing your debrief at the full end of the day with your student. And then asking questions instead of always giving your students answers. Sometimes if a student is struggling with an answer, we just want to hop and give them that answer. But, trying to find ways to ask them, to guide them to that answer can be really helpful in improving that student's critical reasoning and critical thinking. So what we're expecting our students to do during their first internship. So they should be able to introduce themselves to patients, really create a safe environment for the patient and the therapist, assisting in the completion of a subjective history. We want them to be able to document a basic treatment note. They should be able to do goniometry effectively and manual muscle testing. They can do soft tissue massage, vital signs, instruct patients in gait and analyze gait. They should be doing functional movement analysis. They should be doing palpation of bony landmarks, cardiopulmonary examination. They also will have completed their musculoskeletal coursework. So they should be able to go through on more of your familiar patients, things that are more basic, conditions that are more known. They should be able to really complete that evaluation and help out with a large part of the treatment of that patient. So these are our expectations and our benchmarks for that CIET, which we talked about earlier. So really scoring that always on the professional ethics section for the professional behaviors. For safety and initiative, we should see them reach that most of the time. We expect them to meet sometimes for communication, and then well below or below on the patient management section of the CIET. And then for the final rating, We want to see improvement from that midterm rating on that visual analogy that I showed you earlier. So student experience. So if they have the ability, say your clinical site has other disciplines like OT or doctors, speech, we'd love for them to have an opportunity to observe those, working with other practice or working with other disciplines. So whether that be speech or PTAs or even your techs, telling your techs what to do, that supervision is really helpful for them to experience. And if they have any ability to observe surgeries or multidisciplinary care, that's always a plus for them too. So I'll perform a site visit during the rotation halfway through. I'll reach out to you guys shortly during that first week of the rotation. And we'll have a site visit where I'll come in person, or if you're farther away, I'll visit you via Zoom. And I would just recommend reserving an hour. Our sessions usually don't take that long, but I just want to make sure that we have plenty of time to talk if needed. Um, I'll spend some time one-on-one with both the CI and the student, and then we'll meet together as a group to make sure that we feel like the student is on track. And if there are any concerns, I will be following up to help assist in any problem resolution. I know for me, being a CI in the past, it can be hard to get a hold of DCEs, but please don't hesitate to reach out anytime. I'm leaving my phone number and my email. I want to make sure that I am available to you to be a resource at any time. If there's anything that you feel like is, oh gosh, I feel like the student is really struggling. I think they'll probably pass, but I'm not sure. Don't hesitate to reach out early. It's always easier for me to intervene earlier. If you need any guidance, if you're having a difficult situation with a student that you're trying to navigate, I'm here to be that resource to you. I don't want you to leave you fending for yourself and feeling out of the loop. So please, please, please never hesitate to reach out to me. Anytime. My cell phone's on there, emails there, and I try to be really prompt in my responses. If I don't pick up right away for my cell phone, I will call you back within the next few hours. So, any questions? I'm going to jump out of my presentation here and just leave it open for any questions or comments. And two, what I'm going to do after our session today, I know that was a lot of information. So I'm going to post this on our YouTube channel. And I'll also send an email that kind of goes over the highlights and gives you some resources. So you're able to refer to those during the rotation. And then if you have any questions, really don't hesitate to reach out to me. I'll also send just a survey, a quick survey for you to fill out for me, just to give me feedback about this presentation, whether you felt it was helpful and if there's anything that you feel like would have been helpful for me to talk about more or talk about less. But really, I can't stress enough, just don't hesitate to reach out to me because I really want to make sure that you guys all have a smooth process. And, we are a newer program. So, CIs and, SCCEs aren't as familiar with us. And so I just want to make sure that I am that link to make sure that you feel comfortable, confident, and familiar. So this can be a smooth process.
When is that quiz due?
Yeah, so the only thing is that you have to complete that before you fill out your CIET for the midterm. So if you feel like I want to do that right before I want to do that quiz right before I fill out the CIET because that's what I'm gonna be doing it, have to know that stuff. That is absolutely fine. You're able to use your resources too during that quiz. Um, and when you take when you're completing the CIET. So don't worry about that. Um, Again, I'll make sure you guys have plenty of handouts with all those definitions because that helps a lot, just knowing exactly what the familiar versus more of that complex patient is, those levels for, um, always, never all the differences there. Those can be more challenging. And so you guys have a little bit more difficulty with also that guidance versus, independence and supervision. Those definitions can be a bit more just difficult if you're not familiar with them. And I'll give you guys a hand up with those.
So I understand that we're definitely going to be providing guidance with our students the entire
Yeah.
time, but there any percentage which our caseload you want our students to be able to manage, like one to
Yeah.
two patients on themselves or two to three?
Yes. Yes. I mean, it would be fantastic. And obviously, it depends on the complexity of your patients. But for those more simple patients, you're in the orthopedic setting. They've gone through their musculoskeletal content. They have all their patient care skills. By the end of their rotation, I would hope that at least three or four that they're able to go through independently. That they can do an independent evaluation for more of those like basic patients. They may need a little bit of pointers here and there, but they're able to pretty much go through it and document that for you. Is that helpful?
I also have a question.
Yeah,
So I treat pelvic health.
yeah,
And so as far as like letting my student do any of that fun stuff, um,
yes,
what would be your recommendation as far as that?
yeah. Well, so they can't do anything internal because they don't have a certification for that. But if there's like external things like working on breathing, working on posture, if you're doing more advanced progressional exercises with more function, with working on pelvic floor engagement during functional tasks and activities, I would definitely encourage them and have them included in that. And that will be really helpful for them to just get an idea of what pelvic floor PT is, but also like how it is involved in your treatment of all patients. Anything else? All right. Well, thank you again so much for your time. I know that you all have such busy schedules, and I really appreciate you setting some time aside to attend this session. And please don't hesitate to reach out if you have any questions or anything comes up. And I'm really looking forward to working with y'all.
Thank you very much.
Yeah.
Thank you, Kim. Great
Thank you.
presentation.
Thank you. Have a good one, y'all.
You too.
You too. Bye-bye.
Bye.